Hi, I'm Dr. Arbinder Singal, co-founder and CEO at Fitterfly Healthtech. We all know that India is the diabetes capital of the world. But whatever we have done for diabetes, whether it's more doctors, better medications, cheaper medications, easy availability of blood tests, that has not helped us decrease the incidence or the rate of complications of diabetes in India. And we believe technology is the answer to all this. With 400 million people having smartphone access, we can really use technology for various things, and one of them is digital therapeutics. There are a lot of policies and regulatory frameworks which govern the health tech space. The most important being the Digital Data Protection Bill. As a health tech company, we must make sure that the data is securely encrypted and kept, and there is no data which is shared without any patient consent. And Fitterfly follows this very religiously. But this is true for all the hospitals as well as healthcare companies as well. The second thing which we are very careful about is various kinds of certifications such as ISO 27001 or SAMD certification, which is also called ISO 13485, and finally a CDSEO certification which is called Software as a Medical Device certification. It is again very important from global standards and also for operating in the digital therapeutic space. In the Western countries, especially in US, you also need a FDA license, which has not become compulsory in India as of yet. There are a lot of issues when it comes to diabetes insurance in India. Insurers are very strict when they are underwriting policies for people with diabetes. Typically, if your HbA1c is more than 8.5 or it falls in the category of poorly controlled diabetes, most of the insurers reject the policies. The people with diabetes just don't get insurance coverage. But if your HbA1c is in the well-controlled range, even then you have to pay an extra premium. So people with diabetes, what I've seen working with various insurers is the loading or the extra amount which a person with diabetes has to pay is almost to the tune of 60 to 80%, even with HbA1c of 7.5. Now this can fundamentally change. There is a large population of people with diabetes in India, and imagine so many of them are not getting insurance and they're struggling managing the costs of living with diabetes. Now our thoughts about this are very simple. Insurers currently think about just giving a coverage for the health events, and we all know that people with diabetes have longer stays in the hospital, or also their claim ratio is relatively higher. But what if the health insurers can actually engage these patients on a regular basis, help them change their behavior, manage their diabetes better? In such cases, the claims ratio will go down because most of these people will achieve better diabetes control. Who doesn't want to be healthy? In 2016, the first problem which we wanted to solve at Fitterfly was building a credible nutrition database which can tell us how healthy the food which the person is eating really is. And then we linked it to various clinical conditions, and one of them was diabetes. And in 2019, I was diagnosed to have early diabetes. I have a very strong family history of diabetes. My dad has struggled with diabetes for more than 3 decades. I've lost 2 first cousins because of diabetes-related kidney disease, transplant, and then final death. I didn't want to go the same way. So it was like a personal problem which I wanted to solve. And then what we did at that time was we paired the continuous glucose monitoring data along with a nutrition database, and I really understood what was happening in my body with various foods. That became the first version of the product, which is now finally evolved. Now what the system clinically does is that you understand which foods are healthy for you and which are not. For example, I loved eating mangoes, but I just couldn't eat mangoes. They were raising my blood sugar. But I found certain times of the day and certain combinations where mango was not causing such a big spike of blood sugars. And finally in 2021, we added psychology help like mental well-being, stress management, sleep management, behavior change, also a lot of physical fitness, pain management, and that became the final product to give a wholesome 360-degree care of lifestyle management for people with diabetes. Our strong belief is that if it's a healthcare business, then there should be a doctor, a specialized doctor in the founding or the senior leadership team. This becomes very important from many aspects. Simple things such as creating any kind of content, whether it's a blog, whether it's an article, whether it's a calculator or a video, it should follow 3 principles. It should be scientific, it should be engaging, and it should lead to a clinical outcome for the member. And this focus on clinical outcome is what a doctor can add to a healthcare business. For example, if a person with diabetes gets a great clinical outcome, it of course helps the person, family, and the society at large. What also happens when there is a doctor involved in the business, then it brings a lot of trust from the medical community. Because, for example, when I go and present at a medical conference, then doctors obviously understand that this business has a certain kind of clinical bent of mind, there is a clinical proof, there's a scientific data collection happening, and the results are also presented in that way. So the whole clinical validation piece beyond therapy development is also very, very important part of running the business successfully. In Fitterfly Diabetes Prime, we have put together all our learnings over the last few years across thousands of patients to create something which will give great clinical outcomes. One of the important things which we have done is bring the real-time continuous glucose monitoring insights into the app. This means that any patient, when he is eating some food, he can understand exactly how much blood sugar is rising immediately within the next 1 or 2 hours. This helps them make healthy choices, and day-to-day healthy choices drive better clinical outcomes. The second thing which we have done in the program is we have created a lot of good content and digital solutions for cognitive behavioral therapy as well as for physical fitness. Third thing which we have done in the program is we have started a lot of group classes which help the patient engage in a form of community with other members, and that also drives very, very good clinical outcomes. Lastly, we also realized that a lot of our people who were joining the program, they were coming with a very high HbA1c of more than 8, and we realized that an annual program where we can give them normal blood sugars over a longer period of time can lead to a legacy effect, which means the benefits to the heart, to their nerves, to their kidneys will last up to 10 years. That's why we moved to an annual program including a complete package which will help people achieve better outcomes. Chronic disease management is a very, very exciting space. The kind of results and outcomes which we are seeing in diabetes, we would like to replicate in other clinical conditions. So we are venturing into the space of obesity. First 2,000 patients have already joined. Beyond that, we're also working on developing therapy for hypertension, heart disease, and possibly in the next 2-3 years, we will also develop therapy for supporting patients who have cancer or respiratory illnesses. We are also getting a lot of interest from GCC region, where there's a huge population struggling with diabetes, and Southeast Asia. So from the next few years, it looks like we would be able to support many more people with other clinical conditions and also expand outside India in the next 2-3 years.